Hello, good evening, viewers in Nigeria and around the world. It's another Tuesday, and as usual, Tuesdays are for Talking Here with Dr. Laz. And you're welcome to the program. My name is Dr. Laz Eze. Today is a special day. It's the World AIDS Day. And it's also day seven of the 16 days of activism. You know, recall that last week when we talked about issues around gender-based violence, we told you that 16 days of activism against gender-based violence started on 25th November. So today is day 7. But today is World HIV and AIDS Day, and it's a day that started since 1988. In fact, it's actually the first day that is international day that is dedicated for health. Since that day, every 1st of December, specialists around the world, healthcare practitioners, governments, United Nations, civil society organizations use these days to remember those who have lost their life to HIV and also take actions on prevention, on treatment, and galvanize efforts, resources to ensure that we end HIV/AIDS. So in Nigeria, the National Agency for the Control of AIDS, the Federal Ministry of Health, the state governments, everybody, they are taking action. And the same thing is happening in different countries in Africa and around the world. So on the program today, we're going to be speaking to some special persons. We'll have the Director General of the National Agency for the Control of AIDS, NACA. We're also going to have another professional who is also someone living with HIV, doing a lot of work for over 15 years towards the control of HIV. We are going to be talking about a lot of issues, but before we get into the conversation and you also get to meet my guests, see their face, we are going to take a break. Just before that break, I want to remind you to keep following us on our social media handles that are displayed on your screen. And if you are yet to subscribe to our YouTube channel, you still have the opportunity to do so that you keep getting notifications on our various videos. You can watch as many times as you like. Yes, we'll be right back after the break. Do stay with us. Welcome back to Talking Here with Dr. Laz, your favorite health program on television. My guest will be joining me via Zoom. Is Mr. Isah Takuma. He works with the Global Fund Country Coordinating Mechanism. He's a member of CCM, that is called in short, and he represents people living with HIV, PLHIV in that committee. You're welcome to the program, Mr. Isah Takuma.
Thank you very much for having me. I'm a member of the Country Coordinating Mechanism for HIV, tuberculosis, and malaria.
Okay.
The Global Fund just happens to be one of the funders.
Okay, thank you very much. Thanks for that explanation. Yes, and you represent persons living with HIV in that group. And yes, you're also correct. A very experienced professional that's worked for over 15 years, contributing towards ending HIV in Nigeria. Welcome to the program.
Thank you very much.
Yes. Also, the DG, Director General of the National Agency for the Control of HIV in Nigeria, Dr. Gambo Aliyu, is also going to be joining us on this program. He's not joining live, but I had a robust conversation with him. And of course, in the course of the program, we are going to be bringing you those conversations. Let's take a breather and we'll see you right. Welcome back to the program. The global theme for World AIDS Day this year is Global Solidarity, Shared Responsibility. Global Solidarity, Shared Responsibility. And NACA usually comes up with a local theme, in line with the global theme. The National Agency for the Control of AIDS, also came up with a theme for the commemoration of the World AIDS Day. So I had a conversation with the Director General of NACA, and I asked him, what does this day mean to us in Nigeria? Please watch and get his response.
What it means to us is to reflect what is going on globally. And I think what the global theme trying to encapsulate is the fact that there is an epidemic globally that is not HIV/AIDS, and for which the global community is supposed to get united and to help each other, against it. So our task here is to tease that a little bit open and make it work with what we have focused to do, what we're doing now, and that is controlling the HIV epidemic. And we come up with our theme, United to End AIDS in the midst of COVID-19, get tested.
Coming to you, Mr. Isah Takuma, is another World AIDS Day, and over the past decade and beyond, you and so many other professionals in Nigeria take a lot of actions. So let me ask you the same question I asked the DG. World AIDS Day 2020, what does it mean to you?
Well, thank you very much, Dr. Laz. World AIDS Day 2020 means a lot. It means transition from the place of community member demanding for accountability to one of the people on the decision table and ensuring that the voices of my people are heard. So World AIDS Day 2020 means stock taking for me personally. It also means looking back and seeing how much our people have advanced in meeting their basic needs. It means also what is the shape of human rights and gender relating with our HIV intervention that has become so medicalized and locked in between clinical spaces. World AIDS Day 2020 means reflection, and it means it also means taking stock and ensuring that the voices of our people are heard in their diversity, and not just assuming that the people living with HIV are just one homogeneous group. Yep.
Okay, that's a very good point. People living with HIV is not a homogeneous group. There's a lot of diversity, and their needs are not exactly the same. Thanks for making that point. In the course of my conversation with the DG, we talked about the global target. You know, the 1990 was for 2020, and here we are. 2020 is going to end very soon. But the global community have set a new target, 95, 95, 95. Let me try to explain it to our viewers. What this means is 95 target is for at least 95% of persons living with HIV in any country to know their status. And not less than 95% of those living with HIV who already know their status should be on treatment. And not less than 95% of those who are on treatment to achieve viral suppression. By viral suppression, it means that the viral load or the amount of the number of HIV or the virus in the system is so low in such a way that they may not even be able to transmit it to someone else, or it is so low that it cannot harm them, it cannot progress to AIDS. You know, what that means is they are going to live for the rest of their life like every one of us. So that's what the target is about. And you cannot achieve this target without testing. So I asked the NACA DG Nigeria's performance in terms of HIV testing. And this is what he has to say.
At this time, we have over 70% of Nigerians who live with this virus are aware that they are living with this virus. And we have close to similar proportion of them that are on treatment, and we have of those that are on treatment, more than 70–80% of them that are doing very well in getting to suppress this virus, which is the end goal. The end goal is to make sure that, the 1990 and 95, we're talking the last 90 is the 90 that we want to make sure that is attained, and if it is attained, that attainment is sustained. What I mean is, if you have 90% of people knowing they have HIV and they are living with HIV, 90% of those who are living with HIV are aware of it and are taking treatment. 90% of those that are taking treatment are doing well on treatment. You end up with about 73% of the entire people that have HIV in that country having the virus under control. Okay. And this is what we want. What happens when you control the virus? You prevent the virus from leaving the person that has the virus to infect the person that doesn't have the virus. At the same time, you also prevent the virus from hacking down the immune system that fights the virus, from breaking that system to an extent that it makes this individual vulnerable to diseases, which is the stage we call AIDS. It prevents progression to AIDS, and it prevents transmission. It does two things, and that is why we are interested in getting people who have the disease to know they have the disease. We're also interested in them coming to take medication because we know at the end of it, if we succeed in keeping them, to continue taking this medication, we will eventually get to keep this virus away from circulation. And when we keep the virus away from circulation, we at the same time keep the virus away from giving people sickness. That's what we want to achieve.
So still on HIV testing, let me come to you, Mr. Takuma. The HIV self-testing is a new innovation that's just taking center stage in the control of AIDS or control of HIV. And there are some concerns among some professionals, especially those who are medical laboratory scientists and also those who are in the, like psychologists. They are saying that the HIV self-testing takes away the pre-testing counseling component of the practice. They have concerns that, some persons might get themselves tested and perhaps they are positive and no counseling before that, what could possibly happen? What do you think about that? Do you have any concern about the fact that there's no pre-counseling before HIV self-testing?
Well, I have a significant concern regarding HIV self-testing. Reason being that I have been tested sometime before, and I understand the level of apprehension while I anticipated the result of that test, and I can imagine if I had not received any counseling before or after that test. Probably my reaction to the event or outcome would have been totally different. I'm not sure what I would have done differently, but I'm sure I would not have been as calm as ready to follow through with every next step the way I was, because I had somebody who talked to me from a professional perspective and helped me to understand some of those things that were rather difficult to understand. Thinking of self-testing where a person has to saddle this burden by him or herself, I imagine that HIV is not as simple as pregnancy. With pregnancy, we could just use the PT and confirm the status of pregnancy, and but when you talk about HIV, it's a different game altogether. And I think the same rules should not apply to both.
So wasn't
So
your
I,
group
I
personally with HIV consulted before the policy to allow for HIV self-testing got approved and being applied in the country?
Yeah, we were consulted. We were consulted, and we laid out our concerns. So the national stakeholders of the opinion that we are Nigerians. We know we haven't gotten any assessment of the performance of that self-testing. So for every one of us, we are just anticipating.
Okay.
They are anticipating. We're anticipating our own concerns. Some others are anticipating the success.
Okay.
But for what is worth, looking at this from a human rights perspective, we're sure that health is incomplete if emotional health
is not part of it.
It's in question.
Okay,
Yes.
I asked the
for,
DG, sorry, sir, that I have to call you. I asked DG a similar question about this, and let's listen to what he said.
I can see where they're coming. They have concern that maybe if somebody tested himself or herself, and the test happened to be contrary to what one expect, that something unpleasant may follow. Maybe less likely this time around, simply because we've come a long way. Way back in like 2002, 2003, I always give this story. There was a case I had, a patient that came and she was sick, very sick. We had to ask her husband permission to do HIV test. And after the test came out to be positive. The patient was with us in the hospital. But one thing that happened that surprises us was that after 2 days or 3 days, I think a couple of days after that discovery, the patient, the husband of the patient, was admitted to a hospital, and the case was an attempted suicide. He has never been tested. It's only his wife that was tested. And we have cases that a wife may be positive and the husband may turn out to be negative. These are what we call discordant couples.
But don't you think you could still have people who could attempt that based on their level of information? Because the awareness programs on HIV is much less now than it was, and more people are being born, more young people are growing up, without having sufficient knowledge due to a reduction in HIV awareness and promotional activities compared to what it used to be, say a decade ago.
I agree. But one thing also to consider is stigma and discrimination have reduced drastically because of increased awareness and because of the knowledge that there is help now. People don't die from HIV except those people who have decided not to take the drugs or the help that is available.
Yes, well, issues around HIV self-testing is like a whole topic on its own, and I know different persons may have diverse views, but the real thing is, from any perspective, people just want the best to be done. Let's take a break, another break, and we are going to be right back and conclude this conversation. Do stay with us. Welcome back to Talking Here with Dr. Laz. We've been talking about the World AIDS Day, how we can end HIV in Nigeria, and I've been speaking with Isah Takuma, who is a professional and a member of the country coordinating mechanism for AIDS, TB, and malaria. He's also been living with HIV for over 15 years, Yes, global pandemic hit us this year. You know, over 30 years ago, HIV was the reigning pandemic. So, but the good story is now is like any other illness. You know, it's not a death sentence. So, but COVID-19 is another reigning pandemic in the 21st century, and it has a lot of implications on a variety of health conditions, especially in the supply chain. The supply chain is just talks about the movement of drugs from where they are produced up to where they are being used. And due to the COVID-19 lockdown, it has huge negative implications. So I asked the DG of NACA the implication this had on the HIV programming, you know, because many are concerned that people who are already on treatment may not be able to have their medications. And this is what he had to say when I asked him.
We placed orders for drug in June. The production was completed in October. Now, because of the backlog from COVID-19, I cannot have those drugs this year until February next year. That's an example.
Okay, so what do we do in this circumstance?
The only thing we do in this circumstance is to manufacture locally. If we manufacture this drug, supposing the drugs that is now manufactured for me elsewhere in October was manufactured here in Nigeria, I need only 2 weeks, not 4 months or 5 months to get it and to have it distributed all over the country.
Well, because of this delay in supplying the drugs that have already been produced, are there chances of having stockouts? How will it affect patients? Or do we have enough to take care of those who are already on drugs pending February when the other drugs arrive?
So the last portion of your statement is the truth. We have enough to take care of patient pending the time this consignment come. And this is possible because we work as one party. The government and the stakeholders put resources together. Everyone buy and we put it in a pool. If my own finish, I use your own. If your own finish, you use mine. Yes, you heard the DG right there. It's very exciting to know that we have enough commodities to serve persons living with HIV. But Mr. Isah, let me get back to you. You've worked in Abuja, and you are also currently in Yobe State, where you are conducting lots of trainings. You are, in touch with the various groups, the KPs, people living with HIV, those who are receiving prevention to mother to child transmission of HIV. So, what from your experience or your observation in the past few months, do you think that COVID-19 has not had any impact as it has to do with prevention and treatment services? Or if it's had, what impact do you think is, we've experienced so far?
Okay, thank you very much for that question. COVID-19 on its own had not had significant impact on the access to services. Talking about HIV services, ARVs. But then the country's treatment program as it affects the northeast region of Nigeria is calls for a little concern. First is that a lot of the population depend on the primary healthcare service delivery points. Unlike other places like Abuja, Lagos, and bigger cities where you have significant number of comprehensive facilities. And the national program is such that very few of these primary healthcare facilities provide ARVs or comprehensive ART services. So most of them only test people. When they are positive, they refer them for treatment. So if with this being the case, many people have the issues of being able to reach those comprehensive facilities. Some of them have one comprehensive facility in between 3 local government areas, or just one
So
comprehensive
what you are
facility
saying in
in one.
essence is that the number of health facilities in Yobe State and some other parts of the country are not adequate for persons who need HIV prevention or treatment services.
Well, what I'm saying is that the pattern where primary healthcare facilities cannot dispense ARVs, it's the problem, because we have enough facilities. We just need
Okay,
to deploy differentiated service delivery model
okay,
into these primary healthcare facilities, so that people living with HIV in such places as the Northeast can have
okay,
easy access to services,
all right.
regardless of COVID-19. Yeah.
Okay, thank you very much. We would have wished to continue, but our time, is giving us signal to end the program. Thank you, Mr. Isah Takuma. I know you have so much to say, but we are still going to have you again on this program
All right.
to get more insights. And we also have the DG of NACA. I had a very detailed conversation. We talked about HIV funding, adherence to treatment, issues around stigma and discrimination, and partnership, the function of states is a very robust conversation. And we're going to bring them in subsequent programs still on this station. So thank you, our viewers, anywhere you are, for watching us. We won't be here without you. And ending HIV and AIDS is everyone's responsibility. And we are glad that Nigeria has made significant progress in the past few years. Play your part. Let's play. Let me play mine. Let's all know our HIV status. So same station, same time next week. We hope to see you again. My name is still Dr. Laz Eze. Please follow us on social media handles and let the conversation continue. See you again and bye for now.